Our goal at Park Meadows Cosmetic Surgery in working with cancer patients is to help restore their sense of function, their sense of self-confidence, their sense of sensuality and femininity. Our biggest compliment is when our patients come back with tan lines, or better yet, tan with no lines, indicating that we have really helped restore their sense of self. When they're feeling good about themselves, their marriages improve as well. And this has been shown in many different studies. Psychologic function of patients after mastectomy is really truly important. So in trying to find the right surgeon for breast reconstruction, I think number one, a board-certified plastic surgeon, but more importantly, someone who has a passion and experience for this type of reconstruction. Breast reconstruction is one of our passions here at Park Meadows Cosmetic Surgery. We have other passions as well. However, when you look at the statistics for mastectomy reconstruction, again, only 30% of women ever get reconstructed after mastectomy. There are some really good reasons not to be reconstructed, and there's some really bad ones. The bad ones are lack of education, lack of the physician presenting those options to you or the patient, and therefore part of our mission at Park Meadows is to actually take trips to smaller, underserved areas and try to educate local physicians on options for those patients. We may never see those patients, and that's okay. Our goal is to help continue educate the physicians as well as any patients who might be there that they do have an option for reconstruction. We hope never to hear patients say, "Reconstruction? I was never told I could be reconstructed." I'd much rather hear a patient say, "Well, I had a bad tumor at the time and I decided to wait on my reconstruction." Those are good reasons for not being reconstructed. So again, our mission and part of our passion here is to help educate not only physicians, oncologists, breast surgeons, that there are surgeons and good plastic surgeons in Denver who can do breast reconstruction, but also our passion is to serve those patients as well. Most mastectomy surgery and then the following reconstruction, if done that same day, is done in a hospital. Here we've decided to partner with Sky Ridge Medical Center to do our first stages of breast reconstruction. Again, this usually involves a short inpatient stay. If you're using a tissue expander, often it's a 23-hour stay, and most of our patients are discharged at 2 or 3 days if we're doing a deep flap or a bilateral DIEP flap. The secondary surgeries, after they heal 3 to 4 months later, are often done in an outpatient setting. If we can, we like to do them at Park Meadows Cosmetic Surgery in our surgical center. They don't have to go back to the hospital. They're outpatient procedures. The patients leave the recovery room after about an hour to an hour and a half and then go home. Some patients do need to go back to the hospital, but just as an outpatient as well, and they go home the same day. So the first surgery is typically the largest, the hardest to recover from, and once we get them through that, the rest is shape. We call it the rest of the fun part. The rest is shaping, sizing, nipple reconstruction, areolar tattooing to change the shape, the color of the skin around the nipple. These are all outpatient procedures, and many of them can be done under straight local anesthesia.